friends, here we are in chapter 5. So chapter 5 is all about what's going to happen when you hit the hospital, which I have to say I am an expert in. I have worked at 3 hospitals and I did my capstone in labor and delivery at 2 different hospitals. So I've really seen how it works, 3 different states, to get a variety of ideas. Now, I have generally worked in the West. Things in the East are maybe a little bit different, and it may be different in other countries, just so you know, but this gives you a basic idea of what's going to happen. Okay, so you're going to hit admitting. That's usually a front desk. If you are getting induced, they can ask you for all your information, and it may take a little bit of time. I always recommend that people do the pre-admission form. At our hospital, you can do it online, so that makes it simpler. Some hospitals, you have to go in and get it, and then fax it back. People fax anymore, but you know what I'm talking about. It's just a way to get your insurance information so that they get you in the system before you go. So admitting, if you are in rip-roaring labor, they cannot stop you. You should not have to tell them any more than your name, and you go back to labor and delivery. That is a law in the United States that we can't stop you to make you pay if you are in a critical situation, which being in labor is considered a critical situation. So just so you know, you can say, I'd rather go back to my room right now if you're not a scheduled induction. Then you go off to your room. Now, you may go to a triage room. A lot of hospitals have a triage room where they decide if you are in labor. Sometimes you go straight back to a labor room depending on how the hospital runs. Keep in mind that if you're in a labor room, there will likely be a place where you can put some of your items. Definitely ask the nurse if there's an area that is kind of yours for you to put your things in so that they're not all over the place, and it just kind of makes you feel like you're more at home. I don't really recommend, if you're in a labor room, for you to spread out all of your toiletries in there. You might want your toothbrush, or if you have contacts, you might end up using your contacts case, but most of your primping will happen in postpartum, and so I would just bring the basics to labor and delivery. I actually recommend that you have 3 to 4 separate bags, a mom bag.